I grew up in a family where I watched my mother make the decision to send my brother to a home. I was devastated by it. He was my world. And I don't want to have to make that decision myself. Our two sons need a lot of support in the home with basic living skills such as toileting and bathing and eating and keeping them entertained full time, which they don't do by themselves. And that's why the direct care workers are so valuable in our house to keep our family whole and together. Without them, I would be forced to make a decision like that too. And I don't want other people to be forced to make those decisions that I had to watch my mother make.
Dr. Seavey and I began analyzing the Minnesota home care workforce and discovered some worrisome trends, many of which mirror trends in other states. Barriers include uncompetitive wages. Home care occupations are among Minnesota's lowest paying jobs, with wages that fall below the state's low wage threshold. We found a lack of employer-sponsored health insurance coverage. More than a quarter of Minnesota's direct care workers receive coverage through a public insurance program. Despite the essential and difficult work that home care workers in Minnesota do, over 40% of them live in households that rely on some form of public assistance, such as food stamps or Medicaid. Due to the poor quality of these jobs, Minnesota faces enormous challenges in making direct care jobs competitive so that enough people will be attracted to this work to meet the increased demand that's coming as the population ages and more people need care at home.